Foot is pliable and can adapt itself to uneven surfaces. This is because of the presence of small bones which make the foot a segmented lever with multiple joints. Skeleton of foot consists longitudinal arches. It includes medial and lateral longitudinal arches. Transverse arch. Medial longitudinal arch. It represents a big arc of a small circle. It is more prominent when compared to lateral arch. It is formed by more bones, hence it is resilient. Bones forming the arch. Calcaneus, talus, navicular, 3 cuneiform, and medial 3 metatarsal bones up to the head, 2 sesamoid bones beneath the first metatarsal head. Summit. Summit of the arch is formed by trochlea upper surface of talus. Posterior pillar. It is formed by the medial tubercle of calcaneus. Anterior pillar. It is formed by the heads of medial 3 metatarsal bones. Vulnerable part of medial arch is head of talus. Factors maintaining the medial longitudinal arch. Shape of bones. Bones are wedge-shaped with the thin edge directed towards the plantar surface. Intersegmental tires. These bind the lower edges of interlocking bones. Plantar calcaneo-navicular or spring ligament forms the main intersegmental tire. It is supported by tibialis posterior tendon. Tie beams. These structures prevent the separation of anterior and posterior pillar. It includes plantar aponeurosis, abductor hallucis, medial part of flexor digitorum brevis, tendon of flexor hallucis longus, medial part of tendon of flexor digitorum longus, and flexor hallucis brevis. Tendon of tibialis anterior and deltoid ligament exert sling action. Tendon of tibialis posterior supports the arch from below. Lateral longitudinal arch. It represents the small arc of a big circle. Less number of bones and joints forms the lateral longitudinal arch, hence it is rigid. Bones forming the arch. Calcaneus, cuboid, 4th and 5th metatarsal bones up to their heads. Summit. Summit of the arch lies at subtalar joint. Posterior pillar. It is formed by the medial tubercle of calcaneus, which forms the meeting point of 2 longitudinal arches. Anterior pillar. It is formed by the heads of 4th and 5th metatarsal bones. Vulnerable part of lateral arch is calcaneocuboid joint. Factors maintaining the lateral longitudinal arch. Shape of bones. Calcanean angle of cuboid projects backward from the inferior border of the proximal articular surface of cuboid. This maintains the upward tilt of the long axis of the calcaneus. Intersegmental tires. Long and short plantar ligaments. Thigh beams. These structures prevent the separation of anterior and posterior pillar. It includes plantar aponeurosis, abductor digiti minimi, lateral part of flexor digitorum brevis, lateral part of tendon of flexor digitorum longus, and flexor digiti minimi brevis. Tendons of peroneus brevis and peroneus longus act as slings. Peroneus longus maintains the lateral longitudinal arch by sustentacular mechanism. Transverse arch. It consists anterior and posterior transverse arch. Anterior transverse arch. It is formed by the heads of 1st and 5th metatarsal bones. It is a complete arch. Factors maintaining the anterior transverse arch. Shape of bones. Round-shaped head of metatarsal. Intersegmental tires. Dorsal interosseous muscles. Thigh beams. Adductor hallucis and deep transverse metatarsal ligaments. Slings. Peroneus longus and tibialis posterior. Factors which maintain the longitudinal arches also maintain the transverse arch. Posterior transverse arch. It is formed by navicular, 3 cuneiforms, base and shaft of metatarsals. It is incomplete arch. Arch is half dome-shaped and is raised in the medial side. Shape of bones. Wedge-shaped cuneiform bones and bases of middle 3 metatarsal bones accentuates the transverse arch. Intersegmental tires. Dorsal interosseous muscles. Thigh beams. Flexor hallucis brevis. Intertarsal and tarsometatarsal ligaments. Slings. Peroneus longus and tibialis posterior. Factors which maintain the longitudinal arches also maintain the transverse arch. Functions of arches of foot. They help in proportional distribution of body weight in the ground. It acts as a segmented lever which helps in propulsive mechanism of soleus and gastrocnemius. Protection of plantar vessels and nerves.